in the prior guidelines, the recommendation was not to give steroids because, but then since the last guidelines, there have been a couple of very good prospective studies. Still, one very good prospective study done at our VA hospitals here across the US that was negative. Steroids didn't decrease mortality. One very good study done in intensive care units in France that showed that steroids decrease mortality. Then it doesn't mean that the new evidence is all very clear, but there was a discussion looking at the designs of the studies and what happened, and then of course looking at other studies, and meta-analysis, and there was a consideration that even adding the negative studies were more in favor of steroids decreasing mortality. The question still is, in severe acute acquired pneumonia, then when we separate non-severe and severe, in non-severe acute acquired pneumonia, there is no decreased mortality. Then probably non-severe, we can gain the toxicity or the adverse events without any clinical benefit. The non-severe was simple. But in the severe, then there were some studies positive, some negative, but in the meta-analysis, I think there was you need to treat 18 patients or 17 patients to get one decrease mortality. And at this moment, we thought that until more evidence is generated, probably if we need to make a decision now. And people say, well, based on this, what would you do in your institution? Well, I think that we recommend steroids for severe acute acquired pneumonia.